afternoon, everybody. Thank you for attending this e-meeting, this open focus group. We have 6 panelists who are attending this afternoon and are going to be sharing their thoughts about various issues around people living with HIV and COVID-19. Just to give a brief background, this e-meeting is part of EATG's COVID-19 Community Response Project. And there have been a number of outputs from this project during the year. We've had some bulletins and also other e-meetings. So this is an e-meeting that has brought in 6 people, 6 panelists from around the European region, and I'd like to say welcome to them and thank you so much for giving up your afternoon with very short notice, I have to say. So thank you so much for attending this meeting, and we will keep it to time. So the meeting will last around about 1 hour, and we do look forward to some excellent contributions from the 6 different parts of Europe we have represented this afternoon. So if I could ask each of you to briefly say who you are, where you are, and who you're affiliated with, so who you work for or work with. So Sini, as you're top left on my screen, but you could be somewhere else on somebody else's screen. Can we start with you?
Yes, thank you. And thank you for organizing this and inviting me. My name is Sini Pasanen. I'm working for Positiiviset, HIV Finland. So I'm in Finland. We are a community-based organization, the only one for people living with HIV in Finland.
Thank you. Ricardo, do you want to go next?
Yes, hello everyone. I'm very happy to be here with you. My name is Ricardo Fernandes. I'm the current chair of the EATG. I'm also the executive director of GAT Portugal, which is a community-based organization for people living with HIV and hepatitis C, tuberculosis.
Thank you.
And I'm based in Portugal, Lisbon.
Okay. So you don't have any snow. Do you have any snow yet, Sini? No, no snow.
We had yesterday, or was it day before yesterday, for
okay.
1 day.
Okay, that's okay.
No snow for us, as you know.
Okay, Magda, would you like to say who you are?
Hello, my name is Magdalena Ankiersztejn-Bartczak. I'm a CEO from Foundation for Social Education. It's an organization based in Poland. I'm working in Warsaw. We coordinate testing point. We have help for people living with HIV. We have outreach project and working also with injection drug users. I'm the PhD of sociology and a member of EATG too. Thank you for the invitation.
Welcome. Thank you for coming. Denis?
Hello, everybody. Thank you for having me for this opportunity. My name is Denis Godlevskiy, and I am based in St. Petersburg, Russia. And we already have snow, so Sini, you should be having it in 1 day, probably. It's coming, and the winter is coming. And I am a specialist with International Treatment Preparedness Coalition in Eastern Europe and Central Asia. And also I am the director of a small local charitable organization here in St. Petersburg and the EATG member. Thank you for the opportunity.
Great, thanks, Denis. And Zoe?
Hi, I'm Zoe from Cyprus. I am a volunteer and a board member of the AIDS Solidarity Movement. We are an NGO supporting people living with HIV. We have a psychological program of supporting, community testing, surveys, and many other projects that we run.
Great, thank you. Well, it's great to have you all on this afternoon's panel, and thank you so much. So we will be taking the next 55 minutes to discuss some of these important issues. And as we've discussed before, the aims of the meeting really are to explore the community perspectives and experiences of the levels of disruption of COVID-19 and how it's changed the lives of people living with HIV. We're also going to be looking at the lived experience of communities because, as I mentioned earlier, this community project has generated a number of reports, as have many other organizations as well. There are many other interesting reports out there. So we want to drill down and try not to repeat those findings, but what's happening now, 10 months into the pandemic, and what is happening to the day-to-day lives of people living with HIV with regard to their living, but also their access to services. And this is important at this point because as it's clear that we see that COVID is going to impact on many things well into 2021. So what can we learn from this year? What interventions have been most useful? And what can we take into 2021 to try and reduce the disruption on the lives of people living with HIV as the COVID-19 still has an impact. And as we can see from the people here, we've got a wonderful cross-European representation, which I think is one of the key benefits of this meeting. So as we mentioned right at the beginning, the output from this meeting will go into the next bulletin with some additional material, but the main themes coming up from this meeting will feed into that. So if you're happy, we'll start with the first question, and I'll ask for a volunteer to respond first, and then we'll go round, and then we'll go on to the next questions, and there are 4 questions altogether. And one of the, if you could, in your answers, be as free and open as you wish, but examples, specific examples of things are very useful, and also highlighting things you think have worked really well, but also things that still require consideration. What are the gaps, and what gaps might we expect later in the process? So the first question, let's start. So the first question is really generally around the impact of COVID on the lives of people living with HIV. So as we've seen from EATG's bulletins and data from other surveys, they all confirm that COVID-19 has been disruptive. It's changed the lives of people living with HIV. For example, around access to medical and community services, it's reduced social contact, and it's also had an impact on mental health for many affected people. So from what you've seen in your country, what examples are there that you've seen of how COVID has directly affected, but also importantly, how it continues to affect the day-to-day lives of people living with HIV? So that's more of a general open question, and we'll drill down more in the next 2 questions. So who wants to go first? I can choose somebody, but you can feel free. Ricardo, it's going to be you. Sorry.
So okay, man first. Okay. So actually, in Portugal, I would say that we are not the country suffering the most, I'm sure. And although the numbers are now really high, people living with HIV were very worried in the beginning with the impact of the disease on a likely co-infection, which from my point of view shows that we as a society, we were very bad communicating health data to people living with HIV, and of course other diseases, but we are focusing on HIV. So people were really afraid. So this, I think that the first thing that we need to talk is emotional wise, meaning that this was very stressful for everyone living with HIV, because first of the lack of data, and then how data was communicated to people. And people living with HIV, they are usually seen as someone that have immune systems that have problems, meaning that not only the society sees people living with HIV like that, but also some people living with HIV, although they are really strong and they have really nice immunity, they see themselves as fragile. So this means that people were under big stress all the time. Unfortunately, I think that this is also a big wickedness of the system, meaning that in Portugal, and I think all over the world, mental health is not our forte, meaning that nothing was done to ensure people and help people with their mental challenges. Then, of course, there's the elephant in the room, which is COVID, meaning that we started to work our national health system, and I think that it will be similar to other countries, starting to work in a dichotomy of COVID patients, non-COVID patients. So COVID patients were, the big chunk of patients that matters now, and all other disease, including HIV and hepatitis, were put in a little box, a very small box of non-COVID patients. So this brought a lot of challenges, getting care, getting new people to care, new infections to care, and being treated to get drugs. This was really a big challenge to everyone, and it's still, especially now that we are facing the second waves, most of the countries, we don't see a lot of differences from the first wave in terms of how the national health systems are organizing themselves.
Okay.
Okay,
you.
I can
That's okay.
Elaborate more afterwards.
That's fine. Thank you. So, what about Zoe? What's happening in Cyprus?
Well, I guess it's similar to what Ricardo said. The biggest problem at that period was that the visits to the reference clinic wasn't able to do. So the monitoring was interrupted. The access to treatment, people living with HIV could have the treatment, but they needed to have we needed to find other solutions for that, because the limitation of the movement was in place, especially in March. Other than that, the stress was very visible to them and to the community health workers also. And I think also to the doctors and the nurses. It's not only the community. I think also the doctors were worrying about that, how to continue. And especially for Cyprus, we have this, the reality of our political problem was one of the issues that we had to face, because we are living in a divided island. So we had people living with HIV living at north, monitoring in south. And because the checkpoints were closed, they couldn't pass to get their treatment. So we had to find other solutions for that. That was one of the difference, I think, that we had in Cyprus, and it was very strong and stressful that we had to deal.
And how is that different now? What's the situation now in November?
Now the borders, it's not borders, the checkpoints are open.
Right.
But still we have to show a negative COVID test to pass. And last week, actually, the north, they put in new restrictions that if a Turkish-speaking Cypriot pass at south, when she goes back, they have to stay in isolation for 2 weeks.
Right.
So
Yes.
also limits to people to pass.
Okay.
But this thing, it changes every day. I mean, maybe next week we will have something else. So it's not. This is insecurity, and I think it's very obvious for everybody.
Yeah. Thank you. Thanks, Zoe.
Thank you.
Okay, Sini, what's the situation in Finland?
Well, I was kind of general. I think the impact has been, or the emotional impact has been the same for everyone, no, living with HIV or not living with HIV. We did have the doctor's appointments. They have already started changing some of the doctor appointments to a virtual kind of clinics and appointments. So, but now in spring, especially the bigger hospitals, they changed all the doctor's appointments to phone calls, if that was possible. If, of course, if there were newly diagnosed people, they had a chance to actually go to the hospital or to the clinic. Also migrants, if there were some language issues, that it was difficult to have just a phone call. One thing also what Ricardo mentioned in the beginning, especially during the whole springtime, I think it was in media, always HIV was listed one of the risk groups for COVID. Well, we knew that it's not. If you are well treated, you are not. But I think we got more phone calls from close ones and the loved ones who didn't want to actually ask the HIV positive person if they are in a risk group, and they were calling us and contacting us that what they should do, that are they loved ones in real risk because they're very positive to COVID. So that was something definitely what we didn't expect to happen. And there were many of those calls. We didn't have, at least I haven't heard any treatment interruptions. So everyone was getting their treatment as always.
Okay, and what's the situation now then? Are things gradually improving? Are the barriers reducing, do you think? Or are people still very afraid because COVID is still around?
I don't think people are that afraid anymore. So I think that we've been, already since the spring, we were in contact with the clinics and some of the doctors and nurses, and trying to inform us as much as possible. How are the appointments dealt, where you can get your medication, the treatment, and how is the situation changing? So we were in constant contact with clinics.
So there's a strong connection between community and the services.
And I think it's really good that we have a trust to each other, and they trust to tell us all the information and details.
Yes, that's good. Okay, thank you. Okay, thank you for that. Magda, what's the situation in Poland?
In the beginning, we have some similar situation like in other countries, that we have mental problem and people afraid what will happen. We have a lot of phones from the people living with HIV about how it will be treatment. Do HIV clinic are open? And also we had some, especially in the first March, April and May, when the lockdown was in most of countries, some people living with HIV locked down in other countries. So we have the phones from Latvia, Germany and other countries for people, Polish people, that they stayed there and couldn't get to come back, and so they have problem to access for treatment, for care. So we have some work around it. And also right now, people, because in Poland we have the highest number of COVID right now in the last few weeks. So all hospitals are full of people with COVID. So it's no place for other disease. So it's very hard to go to the hospital if you have some problem. And also it's quite similar situation with HIV clinic, because most HIV doctors work right now on the COVID. So there is not so many people working with in the HIV clinic, but from my information, most of them working normally. Of course, most of clients can have phone call consultation, and had treatment for longer time, right now for 3 weeks. So they have antiretroviral therapy normally, but we had right now also still a huge problem with treatment STIs. because of many doctors are out of and some of clinics are also closed, and it's this is some and one of the biggest changes during the COVID time was that the government changed the law and criminalize HIV people. And if you do not describe your HIV status to your partner, you can go to the jail even for 8 years. And there is no reason why they changed it during the COVID pandemic. So they changed the law. So I think it's in the short time. And people afraid coming to the HIV clinic. So we have, as a foundation, sending, for example, treatment for people because they're afraid to come to the clinic because they are old or they have a health problem. So it's also the afraid of coming to the HIV clinic.
And do you think there's any chance of COVID-19 transmission being criminalized in Poland? The same as HIV?
No. It should be, the changes was explained that it's because of COVID, and probably they changed it because of, they put the changes on the law because of COVID, but there is no other reason why HIV is separate than other diseases.
Okay, thank you. Thanks, Magda, that's really interesting. Denis, what's happening in Russia?
Yes, a lot of issues were quite similar to what have colleagues described, and I'm not going to repeat it. Those things related to the delivery of ARVs and the need to stay at home, etc., etc. But I think one of the very specific fears that we had at the very initial stage, when there were data that came about the effectiveness initially of lopinavir-ritonavir, there was a big fear from people living with HIV across the country that there will be not enough lopinavir-ritonavir now to treat HIV and that it will be gone. And in Russia, it's still the drug that every third person living with HIV is taking, so it's quite widespread in use. And also, to add to what already has been said, I think also an interesting twist was related to HIV denialists, who simultaneously became COVID denialists, and all these internet groups, forums, they started to boost each other. And as you know, COVID denialism is quite a widespread, it's more, of course, widespread because of the type of a disease thing. So now they're boosting each other and they're sharing these myths about the various big pharma conspiracies, etc., etc. And this is something I think also very interesting to be on the radar in terms of harm reduction, so to say, or in terms of the information for providing people with the right information. And answering the question, what has changed? I think at the very initial stage, the main fear was that there will be not enough ARVs, we will not be able to, and people were in fact facing the lack and shortages of medications because many of them were stuck in other countries. So community organizations had to organize this response and help to find them the treatment. But currently, I think that the main problem is that the systemic problems that the healthcare in Russia has with relation to HIV, once we have the additional burden of COVID, I think we see that probably next year we're going to face some serious consequences related to accessibility of treatment, but I'm going to talk about it a little bit in the next section.
Yeah, okay, thank you. That's a really good response. Thank you so much for all your comments on question one. I don't see any questions coming in from attendees. I should have said attendees who are not panelists. If you have any specific questions, do feel free to share them. And we'll make sure to ask the panelists your questions. But I think that's been really interesting. So if you're happy, given the time, we can move on to the second question. Which means we should be able to get through all the questions before the end, because I'm keen to keep this on time. So the first question is really an overview of what the impact has been and what's happening now. The next two questions start drilling down a bit. And the first one, really, I was interested in trying to find out what the impact it's had on the day-to-day living of people, the day-to-day life of people with HIV. So we've seen evidence that people in the HIV community, especially key populations, have experienced severe economic stress as a result of COVID-19 control measures, with employers laying off staff, or work being unavailable, or then being simply unable to get work, or simply because the welfare system has been overburdened or hasn't paid out when it should have done, or for other reasons where the day-to-day living of a person affected by HIV has been much more difficult in the time of COVID. So what have you seen in your country about the essential basic living needs of people affected by HIV disrupted by COVID-19? I'll start somewhere else if that's okay. Zoe, do you want to go first on this with the situation in Cyprus? Is the question okay? Do you understand the question? Have I described it okay?
No. Yes. I think the everyday living, I think it's similar with the general public, that everybody felt this insecurity and of the future and of I don't know when new measures will be placed. So if now that I can go to the reference clinic and get monitored and get my treatment, maybe next month, next week, I would not be able, so I need to think and take care of that. And also health issues that they're not HIV. So it's more issues that they need to deal with, and this also reflects in their not reflects, influences also their everyday life. Going to the hospital now is more difficult in general, or to your GP or your personal doctor. Most people, they try, the doctors, most doctors, they try to do everything online via emails or phone calls, and send the patient to another doctor. So there is not personal, the physical communication with your doctor. So it's a bit weird for the people living with HIV, especially. And some of them, of course, it's also the financial issues that it has to do with the everyday also.
What about those people who don't have computer equipment or smartphones? What happens with them when they're being asked to connect remotely to medical services?
Okay, they can use a telephone. So the telephone there is, you don't have to have a smartphone for that. Or maybe, I mean, if it's they are using their relatives or partners to move on. But also the psychological program support during the lockdown, we used online methods to do that, or telephone.
Do you think that works? Do you think the telephone?
It's not the same. It's not the same. But I mean, anyway, we are doing this support line.
That's good.
For people living with HIV. So it's not only information; it's also support line. So.
Okay. Thank you. Thanks, Zoe.
Thank you.
Okay, Denis, do you want to tell us what it's like in Russia?
Yes, I think I would agree that for quite a large part of people living with HIV, that the level of social insecurity was pretty much the same as for the rest of the population. But speaking from the perspective of more vulnerable communities or key populations affected by the HIV, I would say that definitely there were quite a few evidence provided by various organizations that certain patterns related to increased risk of HIV transmissions have also, because of the stress environment, have increased among certain population. For example, people who use drugs because of the social emotional tension, and because of all of these various consequences, tend to use drugs more often. And there were also information provided about that by various researchers. Also, the frequency of chemsex meetings also was observed to increase in large cities like St. Petersburg and Moscow. At the same time, many people who already were on social support from the government, they required additional support from the NGOs, and such services like food support and provision of like very essential hygiene products and things like this were very much required in the first months of COVID. And bearing in mind that in Russia, government provided very limited monetary support to the population. It was only families with kids, but it was very, 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 very much needed. However, after the government provided the amount of, I think it was $600 approximately to families who had kids, despite the fact that it's comparatively a small amount, actually it helped to decrease the very serious burden and requirements and applications that NGOs received for the very basic needs that people had.
Yeah.
Are my observations.
Yeah. Have you seen an increase in homelessness or any other indicators of severe socioeconomic stress?
I don't have this data at the moment, and we have specific organizations who are working with homeless, and usually they provide their report at the very beginning of the next year. So we probably are going to have additional data on this particular issues in January or February.
Okay, thank you. Thank you. Thanks, Denis. Ricardo, what's happening in Portugal?
Well, a lot of things change, of course, since January 2020. As Sini was saying, that was a big change for everyone, not only for HIV, for people living with HIV. However, people living with HIV and some communities that are more likely to get infected, they were living biggest challenges, meaning that, well, they needed to go to treatment, most of them. There was lack of information about how to get treatment. If there was any other options, there was a lot of communication on don't come to the hospital because the hospital is only for COVID patients. But from the other side, you will have people saying, well, you need to take your drugs, don't forget to take your drugs. And they couldn't get their drugs if they didn't go to the hospital because we didn't have at that time a way to deliver drugs to people other than presentially in the hospitals. So
and just sorry, Ricardo, and what about the basic needs? What about kind of food and shelter and security and socioeconomic things?
Yeah, so that was another issue because mainly, for instance, migrants, sex workers, and people using drugs, they were really in big problems because sex workers, because their activity decreased hugely. Migrants, because although we were taking good measures in terms of government, they were not enough, meaning that everyone that had like a process to get legal in Portugal, they they had it automatically at that moment, meaning during COVID time. Then they become illegal again. But anyway, well, it's so stupid. But anyway, at that point, they could have access to health and the most challenging times. But they are also people that are working with very, very how can I say, problematic contracts, meaning that they have weak contracts and that they very easily go to unemployment. So a lot of migrants were not receiving money, and then people using drugs, they didn't have the same kind of support that they usually have. A lot of NGOs and also state government services were closing. So this was a big challenge. People didn't have a way to pay basic things, as you were saying, like food, the rent. So that was really, really a big problem, and no one was thinking on that. So the social part of that. We did at GATT start because most of NGOs, although most of NGOs closed doors or reduce a lot their activity, we did reduce some of our activity, but we keep our services working. And one thing that we did, because of course, if we were not fully working, we had some money that we are not using, was to open a line to this kind of cases, sex workers, migrants, and people using drugs, and also another community that I was not referring, transgender people. They were also having a lot of problems because they couldn't buy some medication that they need. So we were paying food, we were paying rent, we were paying transportation, and also, and the most important thing that we were paying, it was additional medication for other diseases that people that live with comorbidities needed. So that was one of the things that I think it is a big challenge. Portugal is now in a deep economical crisis. We have a lot of money coming from outside, not still the EU bazooka, but we have some money arriving. We have money that the state is also borrowing, internationally. So there's a lot of money. So when we think if this is sustainable for 2021, I don't think so. So meaning that we will be in a worse situation in 2021 if we don't find other means of supporting the community.
Okay, thank you. Thanks, Ricardo. That's really interesting. And you also gave a good example of an NGO intervention as well, which I think was very interesting. Okay, Magda, what about Poland? What's been the impact on the day-to-day living of people living with HIV?
One of the biggest change that we see is that normally people living with HIV has everyday help from the HIV clinic. So they didn't use GPs because they were afraid to disclosure their status. And right now, if you need to go to hospital, you have to have the COVID result. Or if you have any health problem, you have to go and have a COVID test. And the government way is that you have to go to GP or call to GP, and he prescribe or give you a solution to go to the COVID tests. So for people with HIV, it's very hard because some of them doesn't have a GP doctor. So they have to find out a GP doctor to go to the COVID tests. So it's one of the changes that we see very clear right now. As I mentioned before, we have problem to access for STIs testing and treatment. So everybody knows, and the data shows that sexual life is quite similar or even higher, especially with chemsex users. What people said right now, and what we see also in Poland, that when you have social health care and psychological or therapy, most of them are right now online. But very often people, especially with families, do not have possibility to do it at home because they have kids or partners at home. So it's hard to have a room quiet to talk with your therapist,
Yes,
especially
yes.
when you have problem with your partner, and
Yes.
kids are everywhere. And as in Poland right now, again, schools are closed. So all families very often have home office work and also
Yes.
kids staying at home. So it's crazy situation, very hard to work. And
Yes.
and also for have even long therapy if you already had it. So
Yes.
some of cases we know that people going to car to talk with your therapist and have
In the
quiet
car.
for in
Did you say
car.
in the car?
Yeah,
Right.
in
Yeah,
the car.
Yeah, yeah.
And so it's in the normal situation, and from the key population, it's even harder because, for example, my foundation has a mobile testing unit, and we very long time thinking how to do it safety, because it's quite hard to do test inside the car because it's small places, and because of COVID, it's risky. So most of the time we do testing outside. And right now it will be winter and it will be colder. So we again arranged and changed our service to still going, especially for drug users, and do needle exchange and also testing for HIV, hepatitis,
Yes.
syphilis. But again, we do not have too many places that we can send people with positive results. So we have problem with linkage to care, especially for hepatitis C, because for HIV it's quite good. And our people living with HIV saying that they feel very lonely, and loneliness. It's something that it's when you have to stay at home 10 months, you have really
yes. And longer probably as well in some countries, longer. Yeah.
So it's very, very bad. And when you have a problem, but I think it's also from something with success, because, for example, my foundation work more than 150% of our activity. We have to change most of our project in the few weeks to do online. So it also open access for help for people outside of Warsaw, outside from the small village. And also we open the self-test, home self-HIV testing because of COVID situation after the lockdown. So it's we see new clients in our help. So that is also good.
I think that's the kind of thing they were saying for the International AIDS Conference, I think, which was obviously virtual this year, is that they actually had more people from outside places where they wouldn't expect people to be able to attend from. So that's been one benefit. Thank you, Magda. That's really interesting. Sini, what's happening in Finland?
I think we were still on the basic needs, basic living needs.
Yes.
Yeah, I think agreeing what's been said, but also what Denis said. I think it's more the vulnerable communities, people who were already vulnerable for some reasons before COVID-19. So I think in Finland it's been mainly then homeless people, people who use drugs, inject drugs, sex workers also. There is one as we don't have really resources to help any do the social work in our NGO, but at least the city of Helsinki is providing. It's quite good thing they have. There's probably a real English name, but kind of street social workers in Helsinki. So we can call them and they can come almost immediately, and then they can give some help with the social issues, and they can give some food coupons and if needed.
And so, have you seen? Sorry, go on.
Yeah, so we've been using them this year more than ever before. That service.
Yeah. And how's the situation now compared to, say, April or May? Have you seen an improvement, or is there kind of ongoing pressures that are still emerging that are going to be difficult to deal with?
I think it's difficult to say. There were many organizations who didn't close services at all, but I think that there are more services open for example, for homeless people now than in the springtime. Though there are some maybe that you can get breakfast and use the shower. Before they were also, for example, people who use drugs, who might still have home, so they could use that service, but now it's been kind of restricted to only to homeless people that can use those services.
Okay, thank you.
I think it's a bit better than it was in the springtime.
Yes. Okay, thank you, Sini. Thank you. So one question that's come in, and thank you for all of you for your response to that question. That was all really interesting. And one question that's come in from one of the people attending is relating to, because of the impact of COVID, the financial loss it's causing, and how hard it will be to keep focus on HIV, hepatitis, and social support. This person thinks that he will be very surprised if we ever get back to services being what they were before. So there is going to be a great need as we go into 2021 for advocacy to try and get the services back that we thought we got sorted out and were set in stone. Is that something you would agree with? This is an open comment to all of you, question to all of you. Have you seen a slippage in the type of services that are available because of COVID? And therefore we're going to have to start fighting again to get back to the point where we were before COVID, which wasn't ideal, but at least there had been progress from before. What do you think to that statement? Anybody can respond to this.
Well, if I may, of course, there's a lot of difference when people are getting their appointments through a phone call. And so that means that you don't have the same kind of service all the time. I do support online and telemedicine. I think it's a great tool, but I don't think that it has to be used all the time. So there's already a downgrade if you think on that. From other sides, and talking about Portugal, PrEP was really a challenge here. It was before already, and during the COVID until now, it didn't get better. So meaning we had very few people doing PrEP, so we were trying to scale up. And now these very few people, which was 1,000, they are not anymore on PrEP. You know, now you will have 300 or 400 because they had so many challenges to get their PrEP, and because they need to do blood exams, and so it was really difficult. So we will have to fight again to improve. We are already fighting, you know, since the beginning because we knew that this will happen. I don't think that the quality of the follow-up has been put in question. So doctors are still trying to follow up their patients the best that they can, but they don't have the right tools. Starting therapy for HIV positive people, it's also a challenge. So I'm sure that not all the people that need therapy are going to the hospital to start treatment, be because they don't have the opportunity given by the hospital, or being because they are afraid of going to the hospital. Hepatitis C, it's also an issue. So it's a bigger issue. Starting treatment with hepatitis C, it's almost impossible as well. And the number of treatments decrease a lot. So this is just a few examples of things that we will have to fight for once things get a little bit better.
Yes. Does anybody else want to comment on that?
We have a similar situation in Poland that we have. With PrEP and also with hepatitis C treatment, and also we will see what will happen next. Is it will be happen good or bad? The phone consultation with doctors, because for many people outside who are coming to the HIV clinic, it's better when you have some call and you don't have to travel to the doctor. But we also see right now the cases with late response. So somebody is coming to the doctor and the health situation is very, very bad, especially with cancer. So it's also the challenge to can find something on phone, not on the diagnostic.
Yeah. Zoe, thank you, Magda. Thank you. Yeah, Zoe, you were going to say something.
Yes, I agree that it's going to be a very challenging period for fundings also, so we can continue the programs we have. I like to see a positive thing in this, that we don't have to convince, at least for the testing, we don't have to convince any Ministry of Health or anybody that will come to test that the benefits of the testing as prevention. So I think the general public now and the ministry and the politician are very aware of the tool, of this tool that we can use for HIV also. So I think we should use this, and in our at the end of the day, and be able to continue the fundings and continue the work that we are doing.
Okay, thank you. Thank you. Okay. And one other question that's come in, I will keep for the final question because it relates to the final question. But thank you, attendees who we can't see on the screen but are listening in. Thank you for sending your questions in, and do send them in as a chat, and I will share it with the panelists. So we will raise it because the panelists, I think, can see it as well, but we'll raise it. Thank you for your responses to question 2. I note the time. We've only got how many? We've only got 11 minutes left. 11 minutes. 11 minutes. So what I would like to do is, if it's possible, the third question relates to access to services, and the final one is about looking forward to 2021. So if you're happy, what we can do is either spend a short time looking at access to services, and then go on to spend 3 minutes just talking about 2021. Is that okay? Because I wouldn't like to miss out access to services, because I think there's been so many changes in the last year. I think it would be nice to know what's happening now. So if that's okay, we can do that. But I'll try and keep it to time. We may go 1 or 2 minutes over, but I will be determined to keep it to time as much as possible. So the next question is really similar to the one we've just considered, which was looking at day-to-day lives and economic impacts. But now it's more looking at access to services. And what I don't want you to do is focus too much on what's happened previously, but what's happening now. In November, we've seen turbulence during the year and disruption. So what's happening now? Do you see any particular examples of innovations that have been useful as we go into 2021? So if we can start with maybe Magda from Poland, if you can just say very briefly, I'll time you, just a couple of minutes on.
Yeah, I think that the biggest changes is in services with access to hospital, and especially other disease than HIV than you have, or surgery. You don't have idea when it can happen. Yeah. And you cannot plan anything. Of course, when you go to any hospital, you have to have COVID tests. And most infectious disease hospitals are right now COVID hospital.
And that's still the case now, isn't it? Because that emerged earlier in the year in Poland and in different countries, but it's still the same now, is it?
We have right now in Poland, to those who doesn't know what is going on in Poland, we have right now the biggest number of cases with COVID. It's 30,000 per day, and the highest number of deaths. So we have right now the biggest epidemic situation in Poland. So in the March it was much better. We had the lockdown, but we had better situation, epidemiological situation. Now we doesn't have lockdown, but the health system doesn't work. You have to wait for ambulance or waiting in ambulance 8 hours at hospital to have first appointment. So we are waiting in ambulance. So this is the main problem. And of course, in HIV clinic, the number of doctors are much smaller, but everybody wants and take care as much as possible care. So you have longer term for treatment. So you get access for treatment for 3 months right now. And but other problems are still.
So it's still bad now, basically. In fact, it's slightly worse than it was in March.
Yeah, this is the worst situation right now in the COVID situation from the beginning.
Thanks, Magda. Okay, Sini, what about in Finland?
Services. I think the kind of access to HIV clinic, it's as it used to be. I think it's okay at the moment. At least we haven't heard any complaints about it. There's still an impact to other healthcare services like surgeries, minor things. They have been postponed. So I think that we will see next year what the situation will be, how long the queues are. Other services, I don't know. I think it was a really good question that you discussed just before. Kind of like, I think we need to be very careful and aware and follow what's actually happening. What are the services? I'm sure there are a lot of people who have had some services that we don't know yet if there will be a discontinuation or no.
Yes.
So at the moment we don't. I would say that at the moment we don't know yet, as we are in the COVID-19 situation. There is the pandemic happening, so we are not asking for the services that we used to have.
Yes.
So we're kind of fine at the moment. So next year we really have to pay attention what's happening. And
yes. So you think more data will emerge over the next few months?
I think so. Yeah. And then we hear more experiences from people. What has happened? Yeah.
Yes. I mean, can you think of any interventions that you think have been particularly helpful? I think you mentioned in an earlier response that there was a good deal of trust between the community and affected people and services. Any other examples of things you think have helped to make the impact less on people living with HIV?
I think there's a certain level of trust in Finland and in the Nordic countries to healthcare. The healthcare, we trust the healthcare. We trust what the officials are saying. We trust the government, and we have a good government at the moment.
Yeah, you do. So, you do.
I think, yes, and
I want to move there. I want to move there. Yes.
Welcome. Yeah. So I think they are really helpful.
And any other examples of things you think have been helpful apart from trust that you think have been?
Are you thinking of something that I should know?
No. I'm just has remote access proved a good response? Has that worked?
Sorry? No.
Telephone consultations and remote consultations.
I think there are some people who really like it, and some people who don't. If you mean the healthcare now, us, or healthcare, like clinic.
Yes.
The clinics.
Clinic.
Yes. I think there are people who would really like to have also in the future just phone calls with the doctor if there isn't anything, and at least just having an appointment, physical appointment once a year, and then having a call every second time. There are people who would like to see the doctor twice a year, and I think that should be possible also in the future. But I'm sure that there are many people who have been living with HIV long enough that they are really happy with just a phone call.
Okay, thank you. Okay, thanks very much. Thank you. Zoe, do you want to say something about services and how they are now compared to before, and what you see as the major things that have helped people perhaps get better access?
Actually, I don't see any progress. I mean, okay, they were interrupted, the monitoring, and but other than, and now it's back to normal. Regarding the reference clinic, there is no any difference from before. I mean, we didn't have any improvement or try to do everything online or even the appointments. And I'm talking about the reference clinic. We are, with our psychologists and as a movement, we are doing the trainings, the webinars, also some counseling online.
Yes.
And I think that helped us, as someone said before, to I think, Magda, to go to more people and be able to reach more people.
Yes,
about
yes,
that.
yes.
But now there is not any change actually than before the start of the pandemic. So we are back to normal, let's say, with the fear though that maybe it will return back. So we are more prepared for that, to solve problems as access to treatment and this kind of stuff. We are more prepared, but
Yes, yes.
nothing changed. We are back to how we were doing it before the pandemic.
Well, that's quite good, isn't it? That's quite a lot of progress. And what is just for people listening in, what is the current lockdown situation in Cyprus? What control measures are in place?
The only thing now, today, that we're speaking at this time, because I said before, maybe tomorrow it will be something else, we have cities lockdown. So the 2 cities of Cyprus, they cannot go outside from the city, and from Nicosia, we cannot go there. So, and this is till the end of the month. I don't know how it will be after in December. And as far as north and south, it's what I said before, we can pass, but with the negative test of COVID.
Right, and that's quite an important distinction, isn't it? So you have to have you have to have a test done.
Yes.
In order to move around.
For 3 days, valid for 3 days. So if I go the 4th day, I need to do another one.
Yes. Okay, thank you. Thank you. Okay.
Do you have to pay for yourself? Do you have to pay for that?
For the test?
Yeah.
Yes.
Oh, right.
I want to add something that I forgot. Now we have the rapid test also. I mean, so those, Magda, we don't have to pay the rapid test. We need to queue though for 2 hours to do that.
Right.
But it's offered for free from the government. But for the PCR, you need to pay. If you are in a special group that the government is focused at this time, you can register and you can do the test for free. Otherwise, we have many, almost 50% now, they're private tests.
Right, okay. And just to clarify, people within cities can move around, but they can't leave the city, is that right?
Yes, and there is also limitation of the time. I mean, in Limassol and Bafo, at 8 o'clock, they have to be home. In Nicosia, we have to be home at 11.
Right, okay, okay. That's interesting. That's interesting. Because in certain other countries, people have, if they want to move go into a big city to get treatment, they aren't able to travel to the big city. So they're stuck in a very rural part of the country and unable to access any kind of services. That's quite interesting.
But
okay, thank you.
For a special, you can ask for a special permission to move from the city, but then you have to reveal your status and all this complicated.
Yeah. Your HIV status.
Hmm?
You have to.
Yes. I mean, if I want to travel to Limassol for that, then I need to give a reason why I want a permission.
Okay, thank you. Denis, what's the situation in Russia?
So I think with regard to services, what's going to be very much popular is the delivery of ARV treatment to houses of people living with HIV provided by NGOs, because the government system does not have resources for that. And during the COVID first wave and also now, it shows its effectiveness, because currently there is, you know, in many countries, there is this problem of treatment stockouts, and it doesn't matter whether it's the global fund resources or the in-country resources. And when the stockouts are coming, usually the government starts to provide ARVs instead of 3 months, just for 1 month or even 2 weeks to try to increase the amount of treatment, prolong it, and wait till the next supply. So in the times of COVID, it led to the situation that people living with HIV had to visit hospital more often rather than less often. So when representatives of NGOs are ready to step in and the local authorities are ready to change certain legislations, it allows NGO representatives to receive ARV treatment for the clients and then deliver it by card to avoid unnecessary lines and queues in aid centers. So I think this is very important. And to address the question that was in the chat, that HIV is gone off the radar with regard to political commitment from the government, what we do actually, we use COVID as an opportunity, and we use this term that is very popular in Russia, socially significant infectious diseases. Mm-hmm. So since COVID is infectious disease, the department in the Ministry of Health who is dealing with COVID is the same that is dealing with HIV and tuberculosis. So currently we are trying to push for certain good legal changes, wrapping them into the as a candy of socially significant diseases, and that funding needs to be increased for socially significant diseases, etc., etc. And then we put diseases like COVID, HIV, TB, etc., etc., and that's how we try to deal with it right now.
That's interesting. Thank you. That's an interesting term, isn't it? That's interesting. Yeah, yeah. Thank you, Denis. That's really useful. Ricardo, lastly, on this question. I think you muted, Ricardo.
Sorry, I was on mute, yes. Well, health services in Portugal, they've been getting better in terms of how to deal with COVID issues, but they definitely are not okay. People living with HIV that are in most difficult situations in health-wise, they get to have a close follow-up, of course, not only by phone call. Most of them will have a phone call for the next few months, and things were improved once they started, most of the hospitals starting programs of sending drugs to people's house or where people say that they want to receive it. Although this has a lot of challenges as well. So I think that there's a lot of things to improve. I don't think that we are in a catastrophic situation in terms of service being provided to people living with HIV. But I think that the big challenges in the next months is going to be around two different things that I think that we haven't mentioned yet, which is public participation in health decisions, meaning that we were already in the process to have more significantly participation in health decisions. And now with COVID, well, everything changed. So they don't have time to listen to us. And we don't have formal ways to be heard. So I think that this happens a lot in other countries. I think that it's very important because, unfortunately, because we don't have this space, there are some propositions, there are some solutions that the government didn't listen, and unfortunately, who's suffering is people. So we think that we should be engaging in that more often, and that we'll be, of course, working on public participation in the next few months, because without that, services will not improve. From another side, something that was very dangerous during this pandemic, and it's still going to be dangerous in the next few months, it's a thing that Zoe was more or less mentioning, that is how personal data and sensitive data is dealt with. During COVID situation, a lot of there was a lot of things were done with personal data and sensitive data of people that usually it's not acceptable out of COVID pandemic. So I think that we need to look at that and see how the human rights and the individual rights of people were not being respected. Because sending lists to police about how many people is infected and the name of people that is infected so they can check if they are at home or not. Of course, it needs to be done somehow, but it's not being done correctly. So I think this is two big challenges. They are really, one is really connected to human rights, the other to a very, very big fight that we are having since the beginning about how we should be engaged and participate fully in health decision.
Thanks, Ricardo. They're two very important points. And of course, the data, the human rights aspect of the data is something that I think is going to be prominent in many countries. In the UK, we had a big row about an app for our smartphones that was designed by the government. And then they suddenly realized that all our data would be held on a central database, which is already dodgy in the NHS anyway, because the NHS is a very centralized system. So they had to dump that one and provide another app that holds all the data on your phone. So that is a great risk. So thank you for that. So you can see the time has gone on a bit. What we'd like to do is extend it by about another 7 minutes, 8 minutes. So we have time to consider the final question, if that's okay with the five of you. So run it to the quarter to the hour. And of course, Ricardo and I are an hour behind everybody else, I think. So for us, you know, it's 1:45 nearly. Oh, I see that Denis might need to leave. Denis, do you have to leave now? Is that correct?
Yes, I'm sorry, guys. I need to leave for another call.
No, that's okay.
We just started. Yeah.
Thank you so much for coming on at this late notice. We thank you so much.
Yes, thank you, guys. And I'm available on the email to answer any questions, please.
Thank you so much. Thank you. Bye, Denis.
Bye-bye.
So for people left, is it okay to run for another 6 minutes, 7 minutes? Thank you. So the final question is really just looking for the future and also kind of thinking about lessons learned. So I think we've had some examples of various things during this discussion, but I think in this final question, what would be really useful is, what do you see as the key challenge going into 2021? And what would you think is a great example of an NGO or community-based intervention that you think is a highlight of something that works really well, that we can also take into 2021 as something to do again, or to share, or to be repeated. So it's kind of two bits to this last question. So it's looking to the future. What do you see as the main challenge as we now go into 2021? And what is one of the key lessons learned that you think we can really take forward as something that can be shared and that would be beneficial for other community-based organizations? Zoe, I don't think I've started with you yet, have I? Have I started with you?
Yes, but it's okay.
Oh, sorry. Well, if you're happy, if you could start.
Yeah, I'm thinking. One of the things I've just said also to get advantage of the knowledge of the importance of the testing as prevention. That now they're model. One of the things that I was thinking was that for the lesson learned, and not for the lesson learned, for the things that we can do for the 2021. And this will help us to sustain our also organization, especially those that work for testing. And we need to, I don't know, we need to, I think it's for our life in general, to put down our priorities and see what is important and focus on this, so to minimize also the expenses maybe that we have as organization. What Ricardo said, to be prepared also to fight for the for our values based on human rights. This is one of the things, I don't know, for example, we're doing anonymous testing. Now we have to get a name and a phone number. We cannot, because of the protocol, we have to follow, and we want to be okay with that. So I don't know, we need to find ways to protect also our clients and people visiting us, including people living with HIV.
Okay.
Also, the networking, I think, helped us a lot in this pandemic. And linkage to care people that they were stuck in other countries. So we need to use this networking for anything that might come in the future.
And do you see a threat to community-based organizations because of COVID, with, say, funding being reduced, or?
Yeah, I think it will be difficult. I think it will be difficult for everybody, because the government, they spend all the money for COVID, so it will be difficult. So we need to find other ways for fundings and
that's going back to the point that was raised by Ben in the questions, that because there has probably been some regression in some ways, we might need to re-advocate for some of the things we had in place just to get us back. But also, I think, and Zoe, a few of the things you've said have been quite positive, and there are opportunities here, which I think is important.
I'm trying to find the positive thing in every negative thing.
That's good. That's the Mediterranean sun that gives you that. Because when we have rain in the UK, everything's gloomy. But if we had sun, we'd be much more positive. So thank you. Thanks, Zoe. Magda, what would you think to this?
I think this COVID situation changed our thinking of the future. So we have to be very flexible and open mind. And I think it's happened in Poland, in my foundation, that we just have to change our thinking. We have to change our plan and be much more flexible. And it's open access for self-testing for HIV that we started in Poland, and it is a huge success, and I hope it will happen next year, and we will get money for that, because it was only because we have private money. I think it can be also the online help should be go on for those people who cannot come for the normal therapy or help, or so people have much bigger access. But for other side, I agree with Ricardo that we have to look on hand of our government, what will happen with all this data that they collected. But also, as I mentioned, in Polish situation, with changing the law, and we have to change the law again of the criminalization of HIV. And I also agree with Zoe that we have a problem with funding, and this year is the end of most funding that my foundation gathered. So we will send another application, and we will be waiting for the next 3 years project. So we will see what happened, because HIV it's not a priority at all, and you know it's going in Poland with human rights and women's lives and reproductive health. So it's very hard situation right now.
Thanks, Magda. It does sound very difficult, and our hearts are with you in this, because I think Poland certainly is going through a lot of changes at the moment, which is going to threaten many of the rights that we've taken for granted that have been accepted, certainly within European Union countries. So thank you for sharing that. Sini, what's your view of this?
I think the long-term challenges is kind of continuing what Magda just said, that HIV is not the priority. It wasn't the priority anymore before COVID-19, and I think it's less so now. So the COVID-19 has been taking all the space from HIV. So I think I would say that's the biggest challenge that we have in the near future. But that was really good what Denis said, the socially significant diseases. I think that's really good. I'm going to be
well, I think we're all going to use that term from now on. It's a new phrase. So I want to see it on all your reports. Every report I see coming from your countries, I want to see that phrase inside it.
I think there were some, what happened in Finland, we always can apply project funding in May, by end of May. And this year they closed that project funding. So we weren't able to, it was just kind of the basic funding that's in September, but this kind of new projects, it's always in May. So they closed that one, but now they opened it again. So there will be a new possibility in December, mid-December to mid-January, that we can apply new projects.
Good,
so
good.
I think they were kind of preparing that something bad might happen, but it didn't go that. So it was better. So now there is a, I don't know how much money they have, but anyway, there will be a new possibility. Something else, I was thinking about the virtual platforms, and kind of like we were organizing the peer support meetings online in the spring, and they were quite famous in spring. Not anymore. So I think that people are really looking forward to meet in person. So that's what we need. That the virtual meetings, that these are not covering it all what we actually need. So I'm sure that everyone is looking forward to seeing in person.
Yes. Do you see a desire, I think a couple of other people mentioned, for there to be more face-to-face, obviously, but also more virtual? Do you see a thirst?
It's really good that we can reach to people who are living in countryside. That's definitely good. And also that now we've learned to use all these virtual platforms and online meetings. So I think it will be easier also when we are in Finland. Very much, most of the people living with HIV are living in Helsinki and the capital area. So of course we have most of our meetings and events here. But now we can share, we can have kind of online access, something that we can share with people who are living in smaller cities and up north in Finland. So that's really good.
Okay, thank you. That's good. Okay, thanks, Sini. Ricardo, your thoughts on this?
Yes, so I really believe that those things that I mentioned previously are really big challenges: public participation and also human rights. I think that another big challenge is that we'll be in this situation for a long time. Maybe we will have a third wave, meaning that the vaccines will not arrive so early as people were thinking, and even if they arrive, they will not be enough, or we will not have money to pay and to immunize all the population. Meaning that we'll be like this in the situation of a third wave, a fourth wave, and fifth wave, which means that all of this that we've been discussing will be a challenge during the next year. And it means as well that probably in a moment where we need strong community-based organizations, a lot of us will not survive to the economical challenges that we will have in front of us. So I think that that's why I think that public participation is so important, because if we are not in the places where these things are decided, of course, we'll be the first ones to be cut in terms of support. So that's why it's so important, so that we could bring our voices and the voices of people living with HIV and from the communities more affected to decision makers, and make them understand that our support to this community is essential, because otherwise they will not get to these people, and we will have other pandemics that we were almost controlling and that could easily get out of control. So I think this is the big idea of the challenge that we will have the next few years.
Okay, thank you. Thank you. Thank you so much for your responses to that question, and I'm appreciative of the time. So I think we will draw this e-meeting to a close, unless I get a quick message from Anis to say there's anything else, or Fiona. But it's been a real pleasure to talk with you this afternoon, and thank you for giving up your time at such short notice and also longer than you thought. So Zoe, Sini, Ricardo and Magda, thank you for staying till the end. Thank you for your really interesting comments, and they've been greatly appreciated. And as we mentioned right at the beginning, a report from this will be shared with you for your approval before it's made official. And I should say thank you also to the people who've stayed. We've still got 17 participants sitting with us on this journey. So thank you to the attendees who've also been with us this afternoon. So I'd like to draw this meeting to a close. Have a good day, everybody. Have a nice evening, and whatever time zone you're in. And I hope we meet in some form quite soon. So goodbye, everybody.
Thank you,
so
Jan.
much.
Thank you, Jan, for the moderation, which was great. Thank you so much.
Thank you. It's your answers were better. All your answers were better. So thank you very much, everybody. Take care.
Thank you.
Thank you. It was a
Bye.
pleasure. Have a nice day. Bye-bye,
Thank you.
everyone.
Bye.
Bye.
Bye.